Hello, everyone. My name is Dr. Ngozi Onoha. Today, I'm going to be talking about eating disorders. It's a condition that affects millions of people worldwide. We're going to talk about the different types, the causes of it, and how to provide strategies for solving some of these conditions. So, like mentioned, eating disorders affect millions of people in the USA. Mostly, it affects women who are between the age of 12, so women and girls between the age of 12 and 35 years old. So, eating disorders are severe conditions related to persistent eating habits, behaviors that negatively impact health, emotions, and the ability to function in important areas of life. So it's not just about food, it is often symptoms of complex and underlying psychological concerns. So, as mentioned, these are behavior conditions that are characterized by severe and persistent disturbance in eating behaviors, which are associated with disturbing thoughts and emotions. So, the most common types of eating disorders are anorexia. We call it anorexia, but the full name is anorexia nervosa, bulimia, which is bulimia nervosa, and binge eating disorder. So each of these is very unique, but they all involve distorted body image and severe dietary restrictions or overeating. So, the exact cause of eating disorders is not known. It is believed to be a combination of biological, behavior, social factors, and also includes genetics, personality traits, culture, peer pressure. Symptoms may vary, so you may have symptoms that include extreme restriction of food, not wanting to eat much, food binges, excessive eating, purging of food to prevent weight gain, an intense fear of gaining weight, and a distorted body image. And the impact of eating disorders on a person can have quite serious health consequences. So, some of the health consequences include malnutrition, cardiac or heart conditions, gastrointestinal conditions, thinning of the bones, and mental health concerns. So, the diagnosis here of an eating disorder, uh, it entails a physical exam, a history, psychological exam, and discussion about eating and exercise habits. Now, let's go to the treatment. So, the treatment could include psychological therapy, nutrition advice, and medical support and medications. So, it's very important if someone has an eating disorder, they need to seek help. This condition is treatable, and with the right kind of support, someone who has an eating disorder can actually do very well. and improve, and the eating disorder will resolve. So, very important to identify this condition early. So, early intervention and comprehensive treatment can lead to a full recovery. So, I am providing health education content. This is not any kind of medical advice. This information is just for education only, just to raise awareness about these conditions. And if you've enjoyed listening to this video, please share with your friends. Thank you. How not to get premature cardiovascular disease. So, as we know, heart disease is the number one cause of death of adults in the United States. So, there are 8 simple measures to take to reduce cardiovascular disease. Cardiovascular disease is preventable, and by taking these steps, we can reduce our risk of cardiovascular disease. So, the first measure is to eat better. So we should aim for an overall healthy eating pattern that includes lots of fruits and vegetables, whole foods, lean protein, nuts, seeds, and cooking in non-tropical oils such as olive and canola oil. Number 2, avoid smoking. Nicotine is a major cause of premature cardiovascular disease and is a leading cause of preventable death in the USA. So, smoking is bad, as we know. Smoking, mostly nicotine, contains a lot of carcinogenic agents as well as toxins that cause the body to age and cause hardening of the vessels that leads to premature cardiovascular disease. So quit smoking. Exercise is very important for optimal cardiovascular health. So overall, adults should get about 2.5 hours of moderate exercise per week. This is essential. And kids should have 60 minutes of structured exercise every day. Sleep is essential, and sleep allows the brain to develop properly. It reduces the risk of disease and promotes well being. Most adults need 7 to 9 hours of sleep each night, and children need more sleep. Optimize your weight. Excess weight has been linked with cardiovascular disease, and the ideal body mass index is 25. The body mass index calculator can be found online on Google. You can Google BMI, you will find the calculator. You can plug in your height and your weight, and it will calculate the body mass index. Control cholesterol. So, high levels of bad cholesterol or non LDL cholesterol can lead to heart disease because it just sits and blocks the vessels. So, this type of cholesterol can be found in processed foods, saturated fats, and trans fats. So, try to eat clean. Ensure that you're eating fruits, vegetables, whole foods, grains, nuts, legumes, and healthy oils like olive oil. control your blood pressure. Normal blood pressure is less than 120 top number over 80 bottom number. High blood pressure is defined as 130 to 139 for the top number, systolic, or 80 to 89 for the diastolic blood pressure, the bottom number. So if your blood pressure is elevated, see your doctor to start you on medication. When blood pressure is elevated, it puts pressure on the blood vessels of the body as well as the blood vessels of the heart. And the blood vessels of the heart start to age much quicker when the blood pressure is elevated. It puts more strain on the vessels of the heart. Sugar. Excess sugar is bad for us because excess sugar can damage the organs, the heart, the kidneys, the eyes, and the nerves. So, by monitoring your blood sugar regularly, you can control the rate at which you develop premature cardiovascular disease. In people who are diabetics, they need to check their A1C every 3 to 6 months. Also, prediabetes, which is a condition that can lead to diabetes, can be detected by monitoring the hemoglobin A1C. People should avoid refined sugars and eat fruits instead of drinking juice or refined sugars or processed meals. To support our work, in the link in bio, you will see a book. It's a graph paper notebook, composition book, with a beautiful picture of fruits and vegetables in the front. And this notebook will remind you to eat healthy and stay healthy. Thank you for listening. Bye for now. What is imposter syndrome? Let's talk about this. Imposter syndrome is a psychological pattern in which an individual doubts their skills, talents, or accomplishments and has a persistent fear of being exposed as a fraud. Imposter syndrome can cause feelings of inadequacy, self doubt, anxiety, despite the person's competence. Imposter syndrome can be caused by perfectionism, comparing yourself to other people, and undervaluing your own abilities. And this can happen because of a low self esteem, self doubt, or negative self talk. Imposter syndrome is quite common. We know lots of well accomplished people who have complained of having imposter syndrome. Steps to take to tackle imposter syndrome include: recognize and acknowledge the feelings. The first step is to acknowledge that you might be experiencing imposter syndrome and know that it is fairly common to have these feelings of self doubt. What you can do is reframe negative thoughts. So, challenge negative self talk by replacing self doubt with positive affirmations and remind yourself of your accomplishments, skills, and expertise. Seek support. Talk to a trusted colleague, friend, or a therapist to gain perspective and receive validation. Set realistic expectations. Avoid setting unrealistic expectations for yourself. Instead, focus on achievable goals. Practice self care. Take care of your physical and mental health by engaging in activities that promote relaxation and overall well being. Celebrate your success. Celebrate your achievements and successes, no matter how small they may seem. By implementing these strategies, individuals can overcome imposter syndrome and develop a more positive self image. Thank you for listening. And remember, you are capable and deserving of all your accomplishments. Hello there. In our Aging Well series, I'm going to talk about why a daily multivitamin may enhance memory in older adults. So, what is memory? Memory is the ability to store, retain, and retrieve information. As people get older, their memory might decline. So, in a large clinical trial, it found that daily multivitamin led to modest improvements in memory over a 3-year period in older adults, with the greatest increase in memory benefit seen in those with underlying cardiovascular disease. So, what causes memory loss? So, many things can cause memory loss. Memory loss can be caused by vitamin deficiency. Also, aging of the brain can cause memory loss. A daily vitamin does help because as people get older, they may have reduced access to food, inability to chew properly, poor appetite, and may have reduced dietary intake of fruits and vegetables. So, a daily vitamin is essential in older adults. The vitamins help to support healthy brain function. Taking a daily multivitamin replaces micronutrient deficiency. So, vitamins that help memory include vitamin B12 and vitamin D. Studies suggest that a daily multivitamin can help improve brain function and memory in older adults. Always consult with your doctor before taking any vitamin supplements. This information is presented as health education and not medical advice. Hi there, I'm Dr. Ngozi Onoha. I'm going to be talking to you today about the different types of dementia. So, what is dementia? Dementia is a progressive condition. It's a neurologic condition that affects the memory, thinking, and behavior. So let's talk about the different types. There are many different types. Here are the four most common types: Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia. Alzheimer's disease. This is the most common form of dementia. People with Alzheimer's disease have memory loss, confusion, difficulty with language and problem solving. It typically starts around the age of 60 and above. Symptoms of Alzheimer's disease may include wandering and getting lost, asking the same questions over and over again, difficulty recognizing family and friends, impulsive behavior, and difficulty with communicating or speaking. Vascular dementia is caused by conditions in the brain that affect the circulation in the brain. So, conditions like blood clots can block the flow in the brain and cause vascular dementia. Vascular dementia is typically seen in people who are over 65 years of age. So, people with vascular dementia may present with forgetfulness, so forgetting current or past events, misplacing items, difficulty following instructions or learning new information, or seeing things and believing things that are not true. So, hallucinations or delusions. And also, they may have poor judgment. Lewy body dementia is a type of dementia that is caused by an abnormal protein called Lewy bodies. And the Lewy bodies deposit in the brain and cause dementia. Lewy body dementia is seen in people who are 50 or older. Symptoms of Lewy body dementia may include inability to concentrate or pay attention or stay alert, disorganized or illogical ideas, muscle rigidity, loss of coordination, reduced facial expressions, difficulty sleeping, sleeping excessively during the day, and seeing things. Frontotemporal dementia is a type of dementia that affects the frontal and temporal lobes of the brain. It starts between the age of 45 and 64. Symptoms of temporal frontal dementia may include difficulty planning and organizing, impulsive behaviors, emotional flatness or excessive emotions, shaky hands, problems with balance or walking, difficulty making or understanding speech. So, risk factors of dementia. Dementia increases with age. A family history is also a risk factor for having dementia. Having a close relative with dementia may increase your risk. And people with Down syndrome are more likely to develop Alzheimer's disease. Other factors that contribute to dementia include smoking as well as sedentary behavior, so lack of exercise can contribute to dementia. Early diagnosis is important, and diagnosis involves a medical history, a physical exam, neurologic and lab tests, so a CAT scan or an MRI, and treatment may include medications and lifestyle interventions. So, to care for someone with dementia, provide a safe and supportive environment, maintain routines, and minimize confusion, Seek support from healthcare professionals and caregiver support groups. So we know dementia can affect day to day function, executive decision making, like handling of finances, activities of daily living, and independent living. In USA, most people with dementia are cared for in nursing homes. Thank you so much for listening. I'm sure you found this information helpful. Please share with your family and friends. Have a wonderful day.